Hello, my name is Chloe. Follow along as we dive into this part of Defining Moments. In 1928, Dr. Alexander Fleming was a bacteriologist on duty at St. Mary's Hospital. After returning from a 2-week holiday, he found mold growing on a petri dish of bacterial that he accidentally left out. He soon realized this mold was producing a self-defense chemical that can kill bacterial. He named it penicillin. Penicillin prevents the bacterial from synthesizing peptidoglycan, a molecule in the cell wall that provides the wall with the strength it needs to survive in the human body. The drug greatly weakens the cell wall and causes bacteria to die, allowing a person to recover from a bacterial infection. Fleming published his findings in 1929, but he didn't have the resources to mass-produce penicillin. Nor had it been tested on the effects it had on the human body. However, a decade later in 1939, Dr. Howard Florey, a professor of pathology, continued Fleming's work and dreamed to bring this medical miracle to the masses. Along with his colleague, Dr. Ernst Chain, a biochemist, Florey spent extensive time testing penicillin's effect on mice, producing promising results. A year later, in 1940, an Oxford police constable scratched his face while walking through a rose garden. It became infected and the infection spread to his eyes and scalp. After days of injecting penicillin, he began to recover. But there wasn't enough penicillin to continue the treatment. Ultimately, the constable did not survive the infection. By 1941, Foley started working with scientists in the United States. Their goal? Find a method of producing the so-called wonder drug on a massive scale for all of humanity. Finally, one hot summer day, a laboratory assistant arrived with a cantaloupe that she had picked up at the market. Foley noticed that was covered with a pretty, golden mold. This mold turned out to be a different species of fungus, which after mutation causing X-rays and filtration, produced 1,000 times the amount of penicillin as the first batch with Dr. Fleming. From January to May in 1942, 400 million units of pure penicillin were manufactured. By the end of the war, American pharmaceutical companies were producing 650 billion units a month. Throughout history, the major killer in wars had been infection rather than battle injuries. In World War I, the death rate from bacterial pneumonia was 18%. In World War II, after the discovery of penicillin, it fell to less than 1%. The discovery of penicillin impacted the world enormously. Infections that were normally severe and often fatal were easily treatable. And while most of the credit belongs to men like Drs. Foley and Chain, this medical miracle all started as a complete accident. Dr. Fleming famously wrote, "When I woke up just after dawn on September 28, 1928, I certainly didn't plan to revolutionize all medicine by discovering the world's first antibiotic or bacterial killer. But I guess that was exactly what I did." Thanks so much for hanging out with me today. Don't forget to like and subscribe, it really helps the channel out. Till next time.